Welcome, everybody. Allow me to present my first progress report. My PhD topic is exploring HPV-associated diseases in different anatomical areas and their preventive measures. My name is Adél Mózes. I'm a first-year PhD student and also a dentist from the Department of Pediatric Dentistry and Orthodontics. My mission is to decrease the prevalence of HPV-caused diseases, and my vision is to find the best options for HPV prevention and detection. Allow me to introduce our two specific goals. Our first is to reveal the prevalence of oral HPV infection in cervical HPV-positive women through a systematic review and meta-analysis. And our second one is to analyze the concordance between oral and genital HPV within a retrospective cohort study. Our first project started in September 2023 and will be completed in May 2024. A little background about human papillomavirus. As you know, HPV is the most common sexually transmitted pathogen of the 21st century. Globally, 630 million people are infected with HPV. HPV causes more than 5% of the cancers worldwide, which means 400,000 deaths each year. And all of these deaths could be prevented because we know the pathogen and we have several preventive tools. Beyond cervical cancer, HPV can also cause oropharyngeal, anal, vaginal, vulvar, and perineal cancer. In addition, the prevalence of oropharyngeal cancers caused by HPV has quadrupled in recent years. Therefore, our aim is to identify the association between cervical and oral HPV infection. Our clinical question is, what is the prevalence of oral HPV infection in women with cervical HPV? We are using the COCOPOP framework, and we hypothesize that women with genital HPV infection have a high prevalence of oral HPV. The clinical implication would be tailored prevention strategies for HPV-associated oropharyngeal cancers. You can see our systematic search, which we conducted the search key below. We did the search in 3 separate databases, and we have found 5 key articles. Allow me to talk a little about our key articles. Their greatest strength is that they include the exact genotypes, and this is important to us because as an additional outcome, we intend to analyze the prevalence of low-risk and high-risk HPV as well as the distribution of the different genotypes in our meta-analysis. The major limitation of these studies is the oral HPV sampling method because, as you know, the oral HPV sampling method is not standardized. Nevertheless, many articles are written and many researchers studying oral HPV. You can see our flowchart of selection. After the duplicate removal, we got more than 5,000 articles, and after the title abstract selection, we got 106 articles. Our Cohen's kappa was 0.91. As you can see, our topic is feasible. Our Prospero is submitted. We did the duplicate removal and the title abstract selection, and we are working on our full text selection, the progress of which you can see on the slide. And let me move on to our second project, analyzing the concordance between oral and genital HPV in HPV syndrome patients. The planned submission date is September 2024. Actually, FDA does not recommend oral HPV screening at population level because the prevalence of oral HPV is very low in this level. In the US, we can say it's 7%, and globally, it's between 5 and 10%. Despite all of these, the prevalence of HPV-positive oropharyngeal cancers is steadily increasing in the Western world. In the USA, the incidence of these cancers is 4.62 per 100,000 persons, which is the 205% of the incidence rate of the negative ones. Therefore, our aim is to identify the concordance between genital and oral HPV infection. Our clinical question is, what is the concordance between oral and genital HPV in HPV syndrome patients? Again, we are using the CACAPOP framework, and we hypothesize there is concordance between genital and oral HPV infection. The clinical implication would be huge. That would be to determine who should be screened for oropharyngeal cancer prevention. Allow me to present our data for this study. We have more than 4,000 patients' data who attend at the HPV Centrum Clinic between 2016 to 2023. You have to know that all of these patients had some HPV risk, so we are not intent to analyze the general population, but a population at risk. Our inclusion criteria are men and women aged between 18 to 70, non-immunocompromised, and have both genital and oral samples. We intend to study the HPV concordance between oral and the genital regions in individuals and between couples as well. You can see a summary of our aims with the planned submission dates, and I would like to thank you for your attention with my favorite quote from Albert Einstein: "The more I learn, the more I realize how much I don't know." Thank you.
If I understood correctly, the number of HPV-related carcinomas have almost quadrupled in the recent years. Do you know maybe some reasoning behind it? Why is it so common and why is it rising?
Thank you for your question. This is a very important question. And actually, we don't know the answer, and it's very worrying. It can be assumed that has increased because the changes of the sexual behaviors and also the decrease in the rates of tonsillectomies. But we don't have the correct answer.
We saw data regarding global and the USA, but you are investigating the Hungarian population. Do you have any data on the prevalence of HPV infection and HPV-related oropharyngeal cancers?
Thank you for your question. Actually, we don't have data on the oral HPV infection in the Hungarian population. And talking about oropharyngeal cancers, in Hungary, there are more than 1,000 new oropharyngeal cancers per year, but we don't know how many of them are HPV positive. And for this reason, a national epidemiological study has been ongoing for several years to reveal the prevalence of HPV-positive oropharyngeal cancers. And this study will be completed soon, and after that, we will have the data. Thank you.
You mentioned that all patients had increased risk for HPV. What kind of...
Had some risk, yes.
Yes. What kind of factors do you consider for risk factors for HPV?
Thank you. We can talk about HPV risk if someone has HPV in her or his medical history, or his or her partner has HPV, or she has some cervical cytology abnormality, or his partner has this, or she or he has genital condyloma, or her or his partner has genital condyloma.
What type of HPV are you going to investigate? As far as I know, there are several types of HPV which can cause cancer. Are you going to investigate all types or exactly several types?
Yes, we intend to include all the HPV. We would like to subgroup them to low risk and high risk HPV, and also we would like to see the distribution of the different genotypes as well.
Just one question to clarify something. So your clinical study, is it an ongoing registered clinical study, or is it a protocol drafting? Are you actually conducting the study right now, enrolling patients? with all the eligibility criteria defined, all the outcomes defined, or are you in the planning phase?
We are in the planning phase.
Okay, then please clarify this, that this is a drafting of a protocol and not an ongoing clinical study. Okay?
Okay, I referred it, there's a national epidemiological study, but that's
On the
not
title.
mine. Okay.